Are you suffering from fatigue, tiredness quite frequently? Or maybe you've been diagnosed already with chronic fatigue syndrome or myeloencephalitis. Let's talk about NADH. Hello and welcome to another edition of the Ask Dr. Pickel Show. And I would have to say that the majority of our patients that come in, one of their chief complaints at the top of their list is usually fatigue or tiredness. And I'm not just talking about constant tiredness physically through the day. Yeah, that occurs a lot, but also mental tiredness, mental fatigue, where it's like, hey, I'm trying to read a book and it just puts me to sleep. I go for a drive and it just makes me tired. These signs of fatigue, and some people are just tired all day long and they can't sleep at night. These are common things we'll see with chronic fatigue syndrome or myeloencephalitis. Now, again, with chronic fatigue syndrome, the thing is it can encompass a lot of other symptoms besides just fatigue. But the thing is energy is low all the time, and doctors don't know why. Chronic fatigue syndrome or even myeloencephalitis is a label. It's a diagnosis. It does not tell you the cause. The majority of these people, they have different causes, different reasons why this is going on. And that's what we've got to do, is find out those reasons. And that's why we have success with people who have chronic fatigue syndrome or myeloencephalitis. But it's not always caused, of course, by the same thing or the same problem with each patient. All right, so one of the things that we commonly use with these patients who have these issues, or we find needs to be used, is what's called NADH. So what is this NADH? Well, let's dive right in with NADH. So NADH, also known as nicotinamide adenine dinucleotide. You don't got to remember that. What does this really do? Well, it helps to take the food that you eat, hopefully healthy food, and turn it into energy. Now, let me take a side note on food that I didn't write on this, because it mainly comes from meat, eggs, and dairy products. So if you are a vegetarian or a vegan, usually your NADH levels are going to be low because plant sources are not good and you can't really get a lot from plant sources. Very interesting. All right, so what happens if you're low in NADH? Well, I kind of made the list here. Yeah, low energy, fatigue, we kind of talked about that. Decreased mental alertness. A lot of these people say, I have brain fog. I'm just living in a cloud. I'm just not very alert and conscious through the day, even like in conversation with someone. Again, brain fog, clarity, focus, memory issues, especially short-term memory, decision-making, just a lot of these frontal lobe type symptoms. Then decreased mental endurance. We talked about that, especially like reading, driving, anything that requires longer term. Hey, I need to hone in and understand this. Brain fatigue. The brain fatigues easily. Worsening emotions. And I would say to usually tend towards dopamine, which will cause more irritability. I want to isolate myself. Everybody leave me alone or I'm going to strangle you. But overall, mood could be affected in many ways, depression type symptoms, everything. And then what will happen too is if NADH is low, you can't make cellular energy. Well, what's going to happen is increased aging of the body and especially the brain, which can lead to neurodegeneration or neurodegenerative conditions, which is not good either. All right. So, when you take NADH, what happens? It increases the production of energy. It actually works directly with the mitochondria, the powerhouses of your cells, where ATP or energy is manufactured. You got to have it. It's something that our body already has. It's a coenzyme, and if it is low, you got some problems. It increases neurotransmitter production. This is how it can affect mood and temperament. Not only that, mood and temperament, but again, if it's acetylcholine, that's also focus, concentration, memory. And dopamine too will help drive the frontal lobes to give you more attention. Stamina and endurance, and not just physical, but also mental stamina and endurance. Cerebral blood flow, it's actually been shown to help increase blood flow to the brain. Memory and cognition. So helping out on memory, cognition. We're helping the brain out, giving it more energy to do its tasks, and things start to function better. Also, it's been shown to help potentially regenerate brain stem cells, help with brain growth and development. And this could occur at any age. Anxiety, it actually has been shown to decrease anxiety. We'll get to that here in a minute. And here's a couple of interesting ones too. It's been shown to help decrease jet lag and then also decrease hangovers. All right. So here's the first study here, and this is one of the ones I really like because basically this was a clinical trial And what they did is they took NADH and they gave it to some people, and they said, hey, not just some people, these were all chronic fatigue syndrome sufferers. And they said, hey, how's this stuff work? So in these patients, like as I highlighted down here, they received NADH and had a dramatic and statistically significant reduction in their symptoms for the first 3 months. Wow. So this was pretty good. And they're saying, hey, this is pretty darn effective. We think we need to study it more on a larger population. Another study, in this one they took it, or they gave it to chronic fatigue syndrome patients, and they said, okay, how did these people do? Well, they had decreased anxiety, and with stress, they had less heart rate issues, because what they would find is these people, if they endure any stress, their heart's going to start to race, or their heart will start to pound. Well, not only did the anxiety decrease, but the heart pounding decreased. And there's many terms for the heart pounding. Sometimes people will say, oh, it's tachycardia, speeding up of the heart, or an arrhythmia, or they'll just say my heart is pounding, or SVT, supraventricular tachycardia. Again, with the NADH, anxiety and maximal heart rate after stress decreased. All right, here's another one. People who are low in NADH, well, first of all, NADH mediates not only energy and metabolism and mitochondrial function, but calcium homeostasis, aging, and cell death. So, hey, NADH is going to keep your cells alive longer and prevent aging processes. NADH or NAD can profoundly decrease ischemic brain disease. Wow, that means if you get less blood flow to your brain, it's going to prevent damage. And they're saying, hey, this is a novel therapeutic strategy for neurological diseases. Maybe we should look at this more. And another one here. This is about brain diseases and brain aging from the journal called Frontiers in Bioscience. And they said, hey, NADH administration can markedly decrease ischemic brain injury. It's proposed that basically it can help with brain senescence, brain aging, and multiple brain diseases. NADH may expose some fundamental mechanisms underlying brain functions, brain pathology, and brain aging. They're saying, hey, this stuff's pretty neat. We need to look at it further. And I just threw this one in an extra here because basically on this study, they're saying, hey, how does NADH help with Parkinson's? Well, they're saying, hey, NADH can help potentially boost dopamine levels without giving drugs. And NADH may yet prove to ameliorate Parkinsonism. Recommendations for its use are premature. I mean, hey, this stuff looks pretty good, but we need to study it more. All right, so how do we use this NADH? Or what kind of dosages can be taken or should be taken? Well, NADH, you want to find it in what's called the reduced form, reduced beta nicotinamide adenine dinucleotide, NADH. On the bottle, it should usually say about 10 milligrams. You don't need much of this stuff. Most people, just one capsule one time a day, and they're good. Some people, I would say, severe chronic fatigue, things like that. Sometimes I'll see 2. Rarely do people have to take 3, but it has happened in my clinic. I also like NADH coupled with ribose. Ribose is a sugar. It's actually a sugar that our body uses to make ribonucleic acid, which is very important with communicating with DNA, but it has other effects too, and it has no negative sugar effects like glucose and things like that. But about 200 milligrams of that, and then I would say take it 1 to 3 times a day depending on need. And then what I really like about NADH, since it's already a coenzyme that's already in your body, it's something that your body is supposed to manufacture on its own if you don't have any health issues. So it has no known that I've ever seen side effects or interactions. So pretty darn good stuff. But anyway, you should always ask your doctor before you add anything to your list of things you take, especially if you're already taking medications. All right. Well, hopefully everybody got some great stuff out of this NADH time here, and hopefully everybody enjoyed it, especially if you have chronic fatigue syndrome or myeloencephalitis. I think this is one thing that can really help, especially at the mitochondrial level. All right. Have a great day. God bless. And do watch this next video. I think you really like it, and I'll see you next time.